Greetings to all. My name is Renato Samala. I'm a staff physician in the Department of Palliative and Supportive Care at Cleveland Clinic's Taussig Cancer Center in Ohio. Foremost, my gratitude goes to AACE for supporting our project titled Engaging Interprofessional Student Teams to develop and evaluate an educational resource for cancer caregivers. Our project aimed to engage learners from different health professions to identify day-to-day concerns and knowledge gaps of cancer caregivers, create a printed educational material, and give them back to caregivers for evaluation. The project was done as part of Case Western Reserve University's novel interprofessional education program called Clinical Collaborative Practice, which offers students an opportunity to work on clinically based projects as they complete standard electives, rotations, or other clinical experiences. 9 students participated from September 2023 to July 2024, consisting of 4 nurse practitioner fellows in oncology and palliative care, 1 social work masteral student, and 4 pharmacy doctoral students. Apart from working on the booklet, the students attended seminars on key interprofessional education concepts such as psychological safety, deconstructive feedback, and emotional intelligence. 25 adult caregivers for patients with various types of cancer were recruited from our cancer center. Median age was 59. Most caregivers were female, spouses to their care recipients, and lived in the same household. Using a validated questionnaire plus an open-ended question on daily concerns, the top issues identified included reducing stress for patients and caregivers, accessing information on medical care and community-based resources, and communicating effectively with care recipients. Guided by information from caregivers and from previous studies, we created a 20-page booklet titled Tips for Caregivers Navigating the Cancer Journey, with segments on healthcare professionals treating cancer, various treatment modalities, managing cancer-related symptoms, available resources, self-care, and communicating with patients. The booklet focused on patients currently undergoing treatment and contained information based on personal clinical experiences and various references. Creation of the booklet allowed our students with diverse backgrounds to work together and develop unique ideas, share perspectives, and highlight their skills for a common goal. Through another validated questionnaire, plus open-ended questions on its strengths and areas for improvement, the caregivers offered a wealth of feedback on the booklet's helpfulness. They rated the booklet highly on readability and comprehension, and praised it for being well-organized, relevant, encouraging, and audience-centered. Caregivers suggested adding more aspects to improve its ability to motivate action, such as concrete examples, to-do lists, and useful visual aids. The students completed an evaluation form after their time on the project. They rated their experience highly in terms of content, developed skills to work collaboratively, and developed greater respect for people in other healthcare professions. At the end of the project, we felt that in addition to giving cancer caregivers information to fill gaps in caring for their loved ones, the process of involving students provided an opportunity to identify real-life concerns and address these challenges using an interprofessional team-based approach. As a bonus outcome, our 4 nurse practitioners wrote and submitted an abstract detailing their experience, which was selected for a poster presentation at the 2024 Journal of the Advanced Practitioner in Oncology Conference in Texas. We've also written a manuscript, which was submitted to both the R. Davelin Carter Presidential Prize for Best Manuscript and the Journal of Cancer Education. Finally, this was my very first grant-supported research project, which proved to be a rich learning experience. From study conception to grant application, to budget setting, to working with stakeholders, each step had challenges to overcome and moments to gain wisdom from. I also learned a lot about the needs and concerns of cancer caregivers. I'm currently principal investigator for a multi-site survey study on oncologists' perspectives on cancer caregivers. as well as working on improving our prototype booklet and further testing its effectiveness. Once again, I thank AACE for this wonderful opportunity that educated our students, informed current and future caregivers, and fueled my professional growth.